I'm a pediatric neurologist and sleep doctor. I spent 20 years in the Navy, retired, but started doing pediatric sleep. And now I work at Children's Hospital. And my biggest interests are in narcolepsy, that group of disorders, under-recognized. And for those patients, when you diagnose them and treat them, it's life-changing. So yeah, it's a great field to be in. And it's also such an under-recognized area. So patients that have mental health disorders, ADHD, all these other things, sometimes the root of that is a sleep disorder like narcolepsy. So I do that for a career now after my Navy career. And yeah, it's really rewarding. So I would say, what have we done? It's been pretty amazing. If you think about the last 20 years, a lot of interest by industry, by physicians, by researchers in narcolepsy. And actually, if you think about our colleagues in Stanford around the world, figuring out the underpinnings of narcolepsy, knowing that hypercretin is tied to this, has opened a lot of doors. So treatment-wise, we have new therapies. And in fact, the next couple of years, there are going to be a couple other therapies coming that are really, really remarkable. So a lot of treatments coming that'll change it. The biggest gap really still is awareness and diagnosis. So patients often wait 10 years, see 4 or 5 doctors on average to be diagnosed, and that's just not good enough, particularly when I think about my pediatric patients. That's too long. So we can do better on recognizing it. So I'll tell you, this is sort of like the first sort of bellwether event, I think, for a big organization to say, let's put some money down, let's get the researchers here, the clinicians, the patients. So I think this is just huge for awareness. And it's sort of putting a marker on this is going to be the beginning of hopefully the next generation of research for narcolepsy. So it's exciting to be here and meet people, but it's also exciting to be a part of the next step in treating this disease.